Also, electrodes can be used for the aspiration and biopsy. And in children, especially in young infants, we can also go for the tibial tuberosity. So, to go ahead to the demonstration, first of all, we clean the area with betadine and spirit as we do for all routine procedures. The patient should lie in a lateral position which gives and knee flexed, and all the informed consent and everything should be obtained before the procedure. Then we take this towel and with an eye. The eye will focus on the area from where the aspiration and biopsy will be performed and the neighboring area. And after that, we choose the area, choose the spine by the palpation, and then we infiltrate local anesthetic. We take around 8 to 10 ml of local anesthetic and then we infiltrate in the area. It is important that we not only infiltrate the subcutaneous tissue but also infiltrate down to the periosteum because they are rich in blood fibers. And once you reach the periosteum, there will be a crackling or a ruffling sensation felt with the tip of the needle. That way you can know that you have reached the periosteum. Then we infiltrate in that area in the periosteum for a certain diameter, and we inject the entire amount of LA and allow it to take its effect for around 1 to 2 minutes. In the meanwhile, you can check your bone marrow aspirator biopsy needle and then you should go almost at a perpendicular area to the spine. And once the needle touches the bone, you will get some resistance. So you should go further around 0.5 to 1 centimeter into that. If you have loss of resistance, that will be the bone marrow. So you just check it by your hand whether it is fixed or not. Then you take syringe. It is important to take a syringe of at least 10 ml or a 20 ml syringe because a syringe of lesser volume will not cause adequate pressure. Once you take out, you have seen the patient, there is a pain, sharp pain. By that way you know that you are in the marrow and you are aspirating the marrow. So you take around 0.5 ml of marrow and then put it on a slide. And then you discard the blood and then like this you prepare the slides. So when you prepare the slides are prepared like this with well spread tails. It's not that many times you get smears, bone marrow aspirate smears which cover the whole length of the slide. So it should not be that because in that way you either introduce more blood into the slide or there may be clot formation where the cells can be clumped together. So ruling out an effective morphological evaluation. So like this we should prepare. The spreading and all are similar as the peripheral smear, and you should prepare, ideally we prepare at least 10 aspirate slides because apart from morphology, if the patient has any leukemia or lymphoma, you may need cytochemistry for which you need more slides, and also you need aspirates for iron staining, for pearl staining on the aspirate. So you should prepare at least 10 aspirate slides. And after this, you will go for the biopsy. Meanwhile, if you feel that the patient requires any sample for flow cytometry or cytogenetics, before doing the biopsy, you should again aspirate with a separate needle, not the original needle, with a separate syringe, not the first syringe because there may be clot formation inside that. So you should use a different syringe to aspirate for flow cytometry as well as for cytogenetic sampling. So now there will be demonstration of the bone marrow biopsy technique. We can take the needle and we do not take out the needle from the patient's body. We just take out from the bone, will reach the periosteum when you feel that there is no bony resistance, and then you choose an area 0.5 to 1 centimeter away from the penetration in the bone which we use to take the aspirate. Because if you use the same site for aspiration, so what will be there? There will be hemorrhages, artifacts. So you should choose an area slightly away from that, but it should be within the area which is anesthetized. Then you will go with a free movement or a side to side movement, whatever you prefer. Then you should go for a length of around 2 to 2.5 centimeter. The bone marrow biopsy should be at least 1.5 centimeter for a proper evaluation. And then you take it out. So after you take it out, what you do, you will insert this stylet from the side which was inside the bone, because only the other side has a larger bore through which you can take out the biopsy. So with this stylet, it is taking it in. Now you can see that the biopsy has come down. So it's better to keep it for some time on that cloth so that the blood in the biopsy, the excess blood gets little dried out. You should take care so that it is not too dry.
We should make touch preparation.
Yeah, so if for making touch preparation, it should not be full of blood, or it should be more dry. Because if it is full of blood, again the touch preparation will be showing you blood, it will be diluted. So, and if it is more dry, then you will not get any material on the touch. So some amount of blood should be allowed to dry, and then we should prepare the touch. And while preparing touch, we get a lot of slides which are the touch, the biopsy bit is rolled. So remember, it's only a touch preparation or an imprint smear. It's not called a roll smear. So we should not roll the biopsy. So you should just take the imprint as demonstrated in the video. Let's see. So keep it on a slide, on the one edge of a slide. Then with another slide. Just touch it, not brush it. So prepare around 4 to 6 touch preparations. However, if the aspirate is dry, it can be sometimes because some infiltration or some leukemia may have fibrosis, and you may get a dry tag. So if on the touch there are more number of leukemia cells, we will try to do cytochemistry on those slides. So if the aspirate is dry, so we should prepare more number of touch, similar to what we prepare in aspirate, around 8 to 10 touch try to prepare, so that after morphological evaluation sufficient amount of touch slides are left behind so to perform cytochemistry. So after doing all this, all the touch slides should be packed in a separate pack and labeled properly as touch slides. The aspirate slide should be labeled in a separate packed in a separate pack and labeled as aspirate smears. And always peripheral smear should be sent along with the bone marrow. Peripheral smear is the window through which you see the bone marrow. So you should never miss to send a peripheral smear, or if peripheral smear is not possible, send at least a DTA sample so that we can prepare peripheral smear at the lab. And one more important thing, always while bone marrow requisition is sent, a hemogram report, recent hemogram, the ICSH recommends a hemogram of 2 days. If the recent hemogram is more than 2 days, then we should do a fresh hemogram before the bone marrow and send us the values of hemoglobin, platelet count and total WBC count. So you take a finger prick peripheral smear, this we all know how to take. So always allow the spirit to dry off before taking the slide, because if it is not dry, it will show artificial changes in the smear technology. So you take a drop of around 1 centimeter diameter, not at the exact edge of the slide, but 1 centimeter away from one edge, and then you spread it in a tongue-shaped smear. Meanwhile, the patient was being dressed, was bandaged, and preferably some attendant, the patient should lie in a prone position, and some attendant should press over the bandage side for around 5 to 10 minutes so that the bleeding stops. And then the patient is free to go. The smear should be air dried always before packing. And while packing, it should not be like one smear directly over the other. There should be a piece of paper in between. So while you roll to pack the slides, so put one slide.